It is Thursday, September 3rd, 2020. And good afternoon. It is program number 125 from the COVID-19 task force. Our update today will feature Lloyd Phillips, who will be in from the as the Commissioner of Public Safety. Lisa Westaway will be back, but we'd like to start things off on today's program. Tomorrow, the poker houses reopen. And on Monday, we had a representative from Playground in to speak about their plans and what they're doing to ensure the safety of the clients and the workers and the community in general, actually. And today we're joined by Louie Diabo, who is the compliance officer at Magic Palace. He is also working on community relations. We'd like to welcome him to our update. Louie?
Nyawa Joe. So, kwe Kahnawake Ronu. First, I'd like to take the opportunity to thank Lloyd and his team, the task force, for giving us this opportunity to come on and talk about our safety plan and give some assurances to what we've done the last few months at Magic Palace to ensure the safety for our community. So first of all, it's been a long 6 months for us all in the businesses that are opening last. So I hope everybody out there in Kahnawake is well mentally, physically, and spiritually. As we know, COVID has been quite a challenge for many people, including myself and my family. And like my family members, this Facebook feed that you have here has been a lifeline that we've been watching every couple of days. So we're grateful to have it for us. So today I'm here on behalf of Magic Palace, and in particular the KGC license holders, Stanley Mayo and Barry Alfred, who hold the electronic gaming device license permits. First of all, I want to say that poker right now is suspended indefinitely, given the nature of poker due to it being very close proximity to each other, a lot of contact with cards and chips. So we weren't able to find a way to make it safe. So in discussions with the KGC and the task force, we've gone ahead and eliminated that until things are safe in the future, whenever that is. Since it's been a while since we closed on that infamous day of March 13th when we got the memo from the task force and the Gaming Commission, which seems like a lifetime ago, approximately 6 months. And our team, I've been at Magic Palace the last couple of days. We're getting people reoriented to the new normal, training individuals. Our staff are very anxious to see our clientele again, very eager. But like I said, it's a new normal, and it's very they're very nervous on how things are going to go, but we're excited to be going again after 6 months. So I do want to say a big nyawa to our contacts at the Kahnawake Gaming Commission, Nick and Marnie, who we've worked with the last 6 months as well, talking with them every 2 weeks via Skype calls. The COVID task force, I've been in touch with somebody from the task force, whether it be Robin, Lloyd, or Arnold, almost on a weekly basis, and especially the Kahnawake Labor Office, who has been very instrumental in assisting us. We had several visits. I think yesterday was our 5th visit from the Labor Office, so everything we can assure you has gone well. We passed our safety inspection yesterday. Any last minute suggestions that were made, we have incorporated, as well as from the beginning with the task force, as we've been given many suggestions to create this plan that we're very proud of. There's been frequent updates between us and the safety people regarding our plan, and we wanted to also thank Dawaduni Zakta and the Mohawk Council for support of our employees during this time. They had the Kahnawake emergency response measures, which have covered some of our employees who were out of employment, Native employees only. And we're very thankful for that, because it allows us to retain these people who are very valuable to us. And as well, many of our expenses were covered, including the safety measures that we put in. So without the help of the community, we probably may not be sitting here and ready as we are right now. So we've seen that, other businesses around our communities have been closing. There's words that approximately 60% of restaurants will be closing in the island of Montreal. Morella's has remained open with the support of the community, both financially and through patronage as we had takeout. So we're very thankful for that, and we are now open full time. So without the collaboration of support of our people, we wouldn't be here. So it shows to us that Kahnawake sticks together during times of crisis, and I'm very proud to be part of this community and experiencing that. So as a result of these collaborations, I'm here to present you with the Magic Palace plan for employee and client health and safety, which leads to the safety of Kahnawake, which is paramount to us always. Being a community member, having a young family, of course, it's essential for us to make sure that everybody is safe in our community, as we're one big family. And as I said in our introductory conversations here, I have experienced individuals in my family having COVID, so we know it's no joke, and we know that we have to be extremely professional, serious, and committed to what we're doing at Magic Palace. The task force have taken an observe and react / amend position with outside authorities' guidelines, which has boded well for Kahnawake with the safe results we've seen. Many of our competitors outside of the community have been open since July 16th and August 3rd, but the task force has taken a more conservative approach, waiting and seeing, which has worked well for our community, and we have supported and collaborated with them on that approach, and applaud them for putting safety first. Of importance for us as a business, Morella's restaurant has been open to the public for a couple of months now, and the takeout since early in the pandemic. So we were following the task force's restaurant guidelines and capacity limits, and basically what it did is it gave us a practice run to show us opportunity to follow the guidelines and run a safe business, which we have, with 0 infections and 0 issues around the staff and the food, of course. We also entered into a contract with KSCS, providing the Meals on Wheels with them, which was a great venture that we're very happy to have accommodated. We helped our community by providing them with a preferential price, and it helped us by keeping our staff busy. So again, partnership and collaboration with our community has been exceptional at this time. We also took this defensive and conservative approach that the task force has taken, so we have been on the same page since we started discussions back in, I think it was June, where we started talking. And originally, the number that they have come up with of 50 clients is something that we had proposed as well, stating that we know it's a manageable number and we'll see how it goes, It gives us all a chance because with the new normal, nobody was ready for this. Nobody's practiced in this. So it gives us a manageable number for our staff to be able to say, in a nice way, if somebody's mask goes down, I've seen it in lineups at the stores locally and outside the community, golf courses, their masks get below their nose for our staff to say, hey, it's got to be full coverage, wash your hands when you leave, different things like that in a nice way. We've had the benefits to Kahnawake for this approach that we've taken is twofold. As we keep the numbers low in 1 week, and we have an opportunity to observe what is working and what isn't, and to communicate with the task force, KGC, and say, this is what we found was good, this wasn't good, and them to give us feedback based upon their observations. So week 1 is starting tomorrow. Very excited about that. Our doors open at 9 a.m., just like playgrounds do. We're very excited. We already have full booking on Friday night for 50 max. We have locals and non-locals coming, and it will only be on our top floor. Week 2, starting September 11th, we'll be allowed to have 100 people, but in 2 zones, 2 differentiated zones. And how we're going to be controlling that is same entrance, but different exits, and we're going to be giving out bracelets to employees to hand out to clients to make sure that if somebody is leaving, say, orange zone and wants to go into the yellow zone, they have to change their bracelet. We take it, disinfect it, and it gets given to another person. There's going to be 50 maximum bracelets per zone. Any more than that, we know that we're going over our limits, which we will not. Week 3 will be allowed 150 as of September 18th. That is when we will divide our top floor. And now Dio has a drawing there for us of the top floor division. That right now is our preliminary plan. We believe it has been approved by the task force. And for week 4, as of September 25th, we'll be opening a 4th zone, likely dividing our bottom floor. We just had meetings on that yesterday, so we're still working on the specifics around that. But that's very likely. Our building, just of note for the community, because I know everybody's cautious. I'm cautious. Our stakeholders, community members are cautious. So just to let everybody know context, the Kahnawake Fire Brigade has approved us to be able to hold a maximum capacity of 980 people in Magic Palace. So we can ensure that physical distancing will occur within a facility that can hold 980 people, because the maximum capacity that's been approved by the task force is 200. So that's at 20% approximately capacity. Much, much lower than the standards we're seeing out there. Many restaurants are opening at 50% capacity, Walmart, places like that. We're opening at 20% capacity, so we can assure that there will be significant room for physical distancing. So tomorrow morning, we also, at our opening at 9 a.m., we also have Lance Goodleaf from the Labor Office coming. So he's going to be providing support to our staff. You know, little things here and there, providing us with our opening certificate. And, you know, we've been very appreciative to him and Yoganoru, who have been there several times to work with us to improve our safety plan as experts. And as well, we did research from outside. Our hours are going to be continued at 9 a.m. until 4 a.m. As per when we previously opened. Just of note again, the Gaming Commission did approve prior to COVID-19 24-hour opening of facilities, but in conversations with the task force, we all agree that we need that time between 4 a.m. and 9 a.m. to sanitize the facility, which we have all of the equipment ready to go and the staff ready to go. So the question is, what does this all mean to you as a client, employee, or community member? So number one, you're going to need a reservation, mandatory. Currently, we're using a phone-in system because we've had a lot of calls, and with the limit of 50, we can say we've had more than 50 calls in the last few weeks. So we called back our clientele who were on our list, and we started booking them. And we were looking at a full house tomorrow night. I believe there are still spaces for tomorrow, so if people do want to book, I suggest you book soon. And then as of Monday, we are going to be doing an online reservation system on our website. It's very similar to the Montreal Casino one. We do have shared clientele, so we wanted to use something that's very familiar to everybody and that isn't very, scary and difficult. Particularly, we do have a large segment of our clientele who are elderly, and technology isn't always the greatest thing for them. So what we do is we do a blend of both. If they're willing to call, we will register them for them on the system. So. We'll also have a hostess who will give you a quick questionnaire about your health, as you've seen other places. I've been to the pharmacy in Chateauguay. They ask you, how has your health been? Have you gone anywhere the last 14 days? Have you quarantined? Different things like that related to COVID-19. And we're also going to be taking temperature. So yes, it's a little bit more personal, I guess, that people are going to be witnessing, but it's things that we have to do, and we're following the best practices that we've seen in similar facilities across the U.S. and across the world. So if people don't pass the questionnaire, of course, they will be turned away. Employees will also have a daily health check. So we created our questionnaire based upon what is working at both Kahnawake Hospital and Step-by-Step Daycare. So we borrowed their template and customized it for us, and that has been given to all staff yesterday. So they have to check in, let us know. If they are not healthy, they will not be allowed to enter the facility. Masks shall be mandatory at all times for clients and staff. If people show up without a mask, or your mask gets worn out, because right now in conversation with the labor office, it's estimated that after 2 or 3 hours, moisture accumulates within the mask and it needs to be replaced. So we are gonna have masks readily available for people there, both the disposable ones and the Magic Palace masks. So, but we do ask that people please bring your own masks if you can, because then you can go home and wash it. Clients also will be required to sanitize their hands like everywhere else. People have gotten used to it now as you walk in the buildings. I came here at the Peacekeeper Station. First thing I did was wash my hands, take my mask off, come back here before I leave, wash the hands again. So that is going to be encouraged. We do know that there's some people who think COVID is a hoax. We know there's a percentage of the population. So we're going to be very, very supportive in our role with them to just say, look, it's for everyone's safety, whether that you believe that or not, that's okay, but please wash your hands if you want to be here. And if people do not comply, well, we will be removing them from the facility. So that's something we wanted to state to assure the community, but also to give people a warning that, we will be using a warning system. If somebody, after maybe 1 warning or 2 warnings, still does not want to follow the rules, they'll be asked to leave and not come back. So we also want to mention that all machines will be sanitized prior to you showing up, and we've doubled up our cleaning staff and added additional security to help monitor clients coming in and out. Of course, we have electronic camera system, and the eye in the sky will be watching everything and CBing to the security guys there. So again, everybody's required to wear your mask throughout the visit, and then wash your hands when you're done, before and after you get to your machine. Magic Palace has invested approximately $80,000 in materials and labor to make it as safe as possible using the highest industry standards. We have plexiglass shields in between each gaming machine, and I believe Diabo has a picture there of our shields in between. And yeah, so significant investment and time was done to make this customized using the best practices out there. It has been approved by the task force as well as the labor office. But on top of the barriers in between, the fact that we're making people wear masks indoors goes over and above those standards that you see in the US, because many of the US casinos have opened and just have the plexiglass, where we're requiring masks, plexiglass, and constant hand sanitizing. We've moved around our machines, so longtime clients will be surprised by some of the new look, but we've kept everybody's preferences and considerations in mind, because in the end of the day, it's entertainment and people go for what they like and are used to. We've placed hand sanitizer bottles between each machine. So there's a metal holder there, and each machine has a hand sanitizer bottle between it. And as you'll see with the pictures, there's hand sanitizer pretty much everywhere. So everybody will have access to it, and we're going to be giving a lot of friendly reminders to people wash their hands constantly. As well, there's ample signage on the walls and floors. You'll see in the video that we're going to show in a little bit, guiding you in the right direction and guiding traffic to ensure social distancing. Right now, it's just lines in the floor that we made, but if we see in week 1 that people are not complying by it, making mistakes, we may put some mini barriers there just to guide people, like you've seen in some businesses. But we've made it pretty clear, and like I said, the facility is large enough that we don't feel that these types of barriers will be necessary, but we are willing to do that if need be. You'll see in our 1-minute video that a 6-foot distance between each other in lineups when you go to the cage or to the ATM machines will be required. There's large guiding labels on the floor that people will be required to stand on. Again, using best practices we've seen around the community. As part of our discussions with the task force, no alcohol will be served, nor any complimentary food provided due to the risks that accompany both of those things. But Morella's restaurant is open as of 6 a.m., was approved today by the task force. So those who want to show up early for breakfast or take a break from their gaming and go for food and refreshment, Morella's will be open with the same constraints there, 50 people max, social distancing, until 10 p.m. But complimentary water and soft drinks will be sanitized and handed out to clients, as well as coffee with lids. Okay. Our smoking room as well is transferred into a VIP room similar to our existing VIP room. Bet limitations have been increased by the Gaming Commission, so you'll see some machines set at a higher limit as per these new regulations. Valet parking and coat check has been suspended due to the interactions that are potential there, so you're gonna be directed to our parking lots. And as well, our shuttle service will continue from across the street at Highway 132. We are asking clients not to linger in front of the facility, as this is considered higher risk activity, so we require everyone to book in advance and only enter once your time has come. We also welcome people to wait in Morella's restaurant if there's room until your time arrives, or do similar to like what they're doing at the Kahnawake Brewery, where you wait outside in your car and then you get notified by text message. The entrance between Magic Palace and Morella's will no longer be open, so people will have to exit the building, wash their hands, and when they come back in, go through the same screening they did the first time. So there will be no favoritism, everybody's gonna have to go through it. Please, so now I'm gonna show you just a quick 1-minute video showing our new safety measures, because it's a lot of words I'm saying here, and sometimes words are wind, and a video and picture says 1,000 words. So if Westaway can play it for us, it just shows how serious we are about safety for everybody. Now to the technicians all here helping us get the message across. So this video is available on our Facebook page and our website, and you're also welcome to send us any inquiries, questions, concerns to info@magicpalace.ca. So if anybody does still not feel comfortable and wants any type of answers that we can give, we're more than happy to be there for you. So things that you cannot see when entering that we've done as an example is the replacement of our old air cleaning filters with new ones that are certified to trap the COVID-19 microparticulates. So important, as you see a lot of discussions happening with the US schools opening, and they're saying, yes, the kids are sitting in the classrooms, but they're all breathing in the same air. So this was an issue that we had identified. So we said, yes, we're gonna have these HEPA filters, the highest particulate that we can, in place so people can feel assured that the air that's coming in is gonna be very clean and traps COVID. So with all of this said, we want to welcome you back as our valued clientele, any new clients who want to come visit us, and as well as stakeholders in our business, as community members. Many hours have been spent by us and industry experts from the Labor Office, Task Force, and best outside practices to make this the safest business model we possibly can. Again, it's open for improvement and suggestions, and we're always there for you. So we look forward to seeing you, as 6 months has been a long time. And if you have any questions, please feel free to reach out to us, and hopefully we'll see you back as soon as possible. Go, everyone.
Yeah, well, Louie, John, you forgot several things. I just wanted to mention. No, I'm just kidding. All right, we'd like to welcome back a lady who is celebrating her first anniversary as the executive director of the Cattery Memorial Hospital Center. And thinking about that, just about exactly half of that time has been spent here at the COVID-19 task force. So let's welcome back Lisa Westaway.
Thank you. I don't have very big update to provide today, but more so a plea to all of you with respect to collaboration for our visitations on inpatient. So I'd like to go backwards a little bit. Yes, these 6 months have been long. They've been long for all of us, as Louie John said, and they've brought about a lot of distress for many people. And we have gradually at KMHC and on inpatient moved in phases towards implementation of visitation in a manner that is safe as possible, knowing that there continues to be risk around us, but knowing that we can't keep loved ones from their families. And so, as you know, we were completely closed, and then we started off with visits at a very big distance down in the outpatient area. We moved towards closer distance holding hands. The next phase was visits in patients' rooms, and now we're doing visits where family members can take their loved ones outside and for a walk on the bike path. During all of these phases, we have to implement very strict rules and guidelines. We do this for safety reasons. So there are many people that we have to protect. We have to protect all of the residents on inpatient, not just one person and not just one family, but all of the patients. In doing so, we protect all of those who also come to visit the hospital. That is a big responsibility as well. And lastly, and very, very importantly, we protect our staff. Our staff are extremely vulnerable. They come to work every day. They've been working tirelessly for 6 months, dedicating every minute to your loved ones, and they are tired. They are stressed. And when family members are not respecting the rules that we've implemented for your safety and your loved one's safety, then it puts an extreme amount of stress on our staff, who also are risking themselves and their families when they come to work. So at KMHC, we have to put rules in place to protect all of you. And in fact, the last few weeks since we've implemented visits outside, we've had many instances where we see a deviation from the rules, where extra people who aren't triaged are coming on visits and not wearing masks, where people are not following procedure, people are expecting to change appointments last minute without advising anyone. I know it's restrictive and it's difficult. It's difficult for all of us, but if we don't have these rules in place, then our risk level for your loved ones, for you, for our staff, increases drastically. And so I'm asking for all of your collaboration, for you to follow the rules we have in place, whether you agree with them or not, whether you think they're ridiculous or not. We have put these rules in place for very good reasons, and we will continue to maintain these rules despite how people may not agree with them. And we do so based on medical advice from Dr. Gauthier, based on all of our physicians who do rounds, who we protect as well, for all of our staff, all of you and your loved ones. So please, if you can respect the rules that we have in place, this will make it a lot easier for all of us moving forward, and it will allow us to move towards even more lenient measures in the future. So that's my update today. One of the things that we're going to change in the protocol is that we'll be developing a document that we'll provide to you that clearly states the rules that we have to implement in order to allow the visitation. And we'll be organizing this document as a type of social contract that you would sign, so that we're sure that you're aware of the rules prior to the visit. So we thank you very much for your understanding and again for your respect of the rules that will ensure everybody's safety moving forward. Thank you.
Thank you very much, Lisa. And a rather important message that we all need to heed. Coming up next, and our final presenter today is our Commissioner of Public Safety, Lloyd Phillips. Lloyd.
Thank you, Joe. Thank you, Lisa. Louie John for being here to provide the community with some insight onto some of the measures taken at the Magic Palace for obviously to ensure the optimum safety of the community and your patrons. And the example that was given by Louie John is similar to the measures that have been put in place, since June 1st, when we first opened retail, and as we gradually moved into more and more phases of the opening throughout the past several months. The examples that he just laid out are examples that have happened, throughout the course of the summer and throughout the reopening. And I think at the pace in which we were going and the measures put into place have shown that it is possible to safely reopen businesses and such in a way that protects individuals to the extent possible, given the fact that we have not had any cases of COVID related to the reopening of businesses. And I know in this episode, we mentioned a few times about 6 months, and it's been the pandemic was only declared mid-March, but going back to March 1st, actually was the Public Safety Division, along with Category Memorial Hospital Center, were already in meetings, in pre-planning. We were on the radio informing the community what's happening around the world, and preparing for what we seem to be something that was inevitable. We had pre-planning meetings with the Emergency Preparedness Committee in the community. But even then, when the pandemic was officially declared, it did take everybody, by somewhat of a surprise, even though a lot of pre-planning has taken place. It came at us like a freight train, right? We all didn't know exactly what that meant. We all didn't know exactly what measures had to take. And honestly, going back 6 months ago, nobody thought that we'd still be in the state of emergency that we're currently in, and nobody would assumed that we would still be talking about coronavirus or COVID-19 6 months later. So it has been certainly a challenge that we have been dealing with for many months. And as Lisa mentioned, in relation to KMHC staff, I think the staff, certainly from the task force perspective, and a lot of frontline workers who've been involved, in organizations, or even people who are working within other essential services, such as the store clerks and gas station and stuff of that nature. I'm sure people there are also feeling stress and anxiety, and I certainly share that with you. And I wanted to go recognize that without these people, the response would not be the way it was in our community, and the ongoing reopening and the ongoing function of our community wouldn't be what it is today. We've certainly been through a lot in the past 6 months, dealing with the closures. In the beginning, as you recall, closing down the businesses, including the tobacco industry, manufacturing, construction, going to essential services only for all the community organizations, and so on. As difficult as that was, going back 6 months ago, to make those very tough decisions on ordering businesses to close and things to happen, it has proven to be much more difficult to open business. Much more anxiety associated with it, much more planning associated with it, much more people involved to ensure we could do things in a safe manner. And it's been a tremendous community effort to get things done to where we are today, including obviously cooperation by the business people themselves, cooperation by the organizations, and ultimately cooperation by our community at large. We have dealt with many issues that are not really apparent to most people, but we've been faced with issues that are very personal to individuals, things that we never anticipated in 6 months ago that we'd have to deal with. Issues of custody, when everybody was ordered to stay at home and have your own family bubble, and you have your own family stay in one area. And if you have a custody issue with shared custody between children, and having those issues and concerns brought to the task force and trying to find a resolve in dealing with those types of issues. things that we never thought we would have to really address. Various family disputes that have arisen because of again, being isolated in different households, dealing with those pressures on family. It has proven to be one of the biggest challenges that we face. Dealing with the unfortunate of people passing away throughout the pandemic, and then early on only having 10 people allowed to have limited visitation, and working with families to try to keep them safe, but also allow them to have that mourning period and grieve their loved one. Very difficult times for everybody. I lived it myself, so I know firsthand how difficult that could be. But these are some of the things that, kind of the 6-month check-in, I just wanted to raise that with the community, because these are some of the things that maybe people haven't really seen or understand the complexity of the things that we dealt with here on a day-to-day, week-to-week basis, as a task force, and housing issues, border crossing issues that are certainly beyond the control of the task force on what happens at the border. In the Quarantine Act of Canada, we get daily inquiries about that. And we're certainly sympathetic to the fact that many people work in the U.S. And need to access New York City or wherever they work to create a living for themselves. But there are certainly obviously restrictions that apply. Some that obviously are beyond the control of the Kahnawake task force. We talk about the terminology, the new norm, entering the new norm. Well, I'll take it a step further, and I believe we are in the new norm. We're not entering the new norm. As outlined, by Louie John as one example on how business will function for the foreseeable future. Schools opening soon, and how that's going to be much different for everybody involved. The way the organizations are going to gradually start reopening and moving away from essential services only, providing additional services to the community in a new way. This is the new norm we're living. And until there's a time where there's a vaccine, where there's proper treatment and control of the virus, this is the new reality in which we're going to have to be living. And we're going to continue as a task force to fulfill our mandate to the best of our ability, continuing to watch over the community to keep us safe as possible, but at the same time understanding that we have to continue down that path of further opening things, further having a life as normal as we possibly can, allowing more people to return back to the workforce so they can create a living, so they can get their businesses back on track to the best of the ability. So we're going to keep moving in that direction. We're going to keep monitoring what's happening in the community first and foremost, but keep an eye on what's happening in the Montreal region, what's happening in Quebec, Canada, and obviously around the world. Because as we've seen how the pandemic started, obviously in China, it worked its way through Europe, eventually got to the shores of North America. So we have to keep tabs on what's happening around the world and plan if we see a pattern coming our way, so we can prepare ourselves, prepare the community to address a potential second wave. We are developing those plans in case we do have to go down that path again. And as I said before, those are plans that are being developed that I honestly hope we never have to use. But if we have to use them, I certainly want to be able to reach into a cabinet, a drawer, and pull out a plan that we could follow. We learned a lot over the past 6 months. We're going to continue to learn. We're going to continue to adapt, and we're going to continue to do everything we possibly can to keep the community safe. So with that, I'll see you again soon. Kahnawake, thank you very much.
Very well said, Lloyd. Very well said. Well, we had a busy program today. We will be back next week, of course, on Tuesday and Thursday as we continue to deal with the issue head on. We'd like to thank everybody for taking time to watch today. We'd like to thank Louie John for being here to make his presentation, of course, Lisa and Lloyd. And just a little thought before we leave. As a kid, I watched a lot of baseball. I still watch a lot of baseball. And Tom Seaver was probably the best pitcher of his generation, passed away, and which is a sad thing. He played for the Mets. I was an Expos fan, so I didn't like the Mets, but Tom Seaver was a great pitcher, and he died the other day of COVID-19. So it does, you know, it's still out there, and we still have to stay vigilant. We still have to wash our hands, social distance, and wear your mask. Go adano, one of you.